Hello, my name is Jason Arnold, and this is my video log for Health Informatics course 645. This is part 1. Again, my name is Jason Arnold. I'm a behavior specialist at Central State Hospital in Milledgeville, Georgia. And what we do is we take individuals that are either transferred from the community or from jails here in the area or from other group homes in the area and even hospitals. And what we do is we either take them in for civil commitment because of NGRI, not guilty by reason of insanity pleas, or we actually get them to competency through a competency evaluation. So in this case right here, we're talking about a subject, individual named John Smith, who's here for a competency evaluation. Mr. John Smith is a 49-year-old male suffering from schizophrenia as well as polysubstance abuse disorder. He was recently charged with aggravated assault ×3, terroristic threats ×3, as well as assault on a peace officer, trespassing, and felony possession of a controlled substance, which was crack cocaine. The individual was uncooperative in identifying present address as well as any social support or next of kin. And again, he was transferred from the Baldwin County Jail on May 18th. As far as qualification of risk, the subject has a history of violence, a history of substance abuse, a history of suicidal ideations, as well as a history of victimizations due to his past charges. Also, a risk, an inherent risk, is potential exposure to Hep B because of his intravenous drug usage. He has a risk for violence because of his apparent charges and history, as well as a risk for suicide. Because he will not adhere to medication, he will be medicated involuntarily, as well as Depakote sprinkles being placed on his food twice daily for mood stabilizations until psychosis has subsided. And the nurse will definitely extend that order if need be. As far as the controls of his risk, the subject is on a 2-to-1, which means that he's on 2 staff to himself, 2-to-1 for aggression when he's out of his room or when he's in treatment setting, in the classroom setting. And he will be on a 1-to-1 when he's in his room sleeping for suicidal precautions, which means that his door will be open and he will be in suicide garb, and his clothing and sheets will be taken out of the room, and he will have tear-free sheets to prevent any ligatures from being placed around his neck. Staff will also be trained on any behavior guidelines to follow, as well as, again, refollowing safety care procedures, and those plans will be used and trained by the behavior specialist, myself, as well as the charge nurse on shift. Okay. Lastly, we do understand that he will attack unprovoked, so staff are to make sure they monitor him closely and utilize the safety care techniques at all times. The effort for his procedures is to make sure that his aggression gradually reduce by medication treatment, and also by the anger management, symptom management, and substance abuse treatment courses that he will be enrolled in once his 72-hour admissions application is complete. We want to make sure that he's able to be found competent, and that will be pending a psychologist evaluation. As far as any residual risk, we understand that the individual may want to avoid classes by threatening staff, and he has a history of that is notated. And he may also file grievances or complaints to put specific staff under investigation so that he can get the biggest, most aggressive staff off of the unit, so that he can then manipulate his way on the unit and victimize other people that may not be as aggressive as him. He has a past history of being on one of the most aggressive floors. However, he is on the admissions unit this time because of the vast number of admissions we had over the past week. But his transfer is pending. All right, so we are making sure that he is able to at least have his psychosis subside before he is transferred. Lastly, the individual has a history of malingering. He will definitely not adhere to the treatment schedules in class and will utilize that so that he can get out of his charges. And he does have a history of that. So we want to make sure that staff notes that, and we also note that in his records so that any treatment team staff or teachers may know that in his records and can understand that, so we can do a parallel study on him to make sure that he is not only malingering but not following through to his treatment. Thank you for your time. Again, that is a brief case history of Mr. John Smith and our treatment plans for him. I welcome any questions, comments, criticisms, or concerns. Thank you so much for your time, and you guys have a blessed day. Thank you.